Hello, I'm Edouard Demeire, visiting professor of marketing, Pharma faculty member, and consultant to various pharmaceutical companies. This short video will help to understand how to bridge the gap between conventional blockbuster marketing and a new trend called customer experience journey management in the pharmaceutical industry. In blockbuster brand marketing, the adoption ladder is then used to achieve launch excellence. In a first step, stakeholders have to obtain brand awareness. Then we must ensure that their interest is raised for the benefits offered by the brand. Then, handling various objections the stakeholders might have, we need to convince them of the benefits offered. Then eventually they will try the new brand and then finally fully adopt the new brand. In this blockbuster brand marketing model, tactics are then designed to push the brand with the various stakeholders through their particular adoption model. And KPIs are then used to track, for example, brand awareness, trial, usage through, for example, something that is called ATU research. This is a relatively standard approach to launching specific brands. In the customer experience journey model, we follow each of the steps in the journey of a specific stakeholder. Here we have taken an example of KOL oncologists. In each of the steps, we will try to understand what this customer will do, what they are thinking about, how they feel about this particular stage in their journey, and whether these constitute any type of what we call pain points, which is negative, or moments of truth, which is a positive experience. So here, for example, the KOL typically treats patients as usual and performs trials as usual, etc. They're a little bit frustrated by the fact that they have the inability to read all clinical data for all types of biomarkers and all subpopulations that might exist. At the same time, in a second step, they do hear of some new sequencing approach, which sequences the whole genome and the resulting biomarker prescribing process. And so they're sort of intrigued about this particular process, but they still sort of feel that they need to manage this trade-off of needing to know about these things as a KOL, but also the hassle of going through this genomic sequencing and then trying to identify optimal therapies for the patient. They then evaluate the clinical data and try to sort of attempt this sequencing and then prescribing according to the sequencing. That they're sort of feeling that the data is sort of convincing, they find this exciting, but also feel that this will dramatically increase the complexity of the typical oncologist's work. It seems there may be over 1 million different types of cancers if you look at all of the combinations in the genome. And in a sense, they're not totally comfortable with this sort of analytical and artificial intelligence approach that is following this new sequencing approach. Then at a certain point, they might sort of feel they adopt the sequencing approach and then start to prescribe according to the markers. They find it takes a lot of time to do this, but they see this as their role as a KOL, and they sort of feel a bit frustrated by the fact that maybe computers will take over their decision-making role as a prescriber. In a final step, they then really feel that it's so beneficial for the patient that they must advocate this new approach of personalization of the treatments to specific patient populations, and they feel in a sense honored that their name is associated to this very new approach. So what we're really doing here is trying to get under the skin of a key opinion leading oncologist to really understand what are the steps in the journey, what does it do in each of these steps, what do they think, how do they feel about this, and which are the difficult issues. Then we're going to be innovating using, for example, some blue ocean approaches to try to find a combination of face-to-face tactics, digital tactics, a combination of commercial tactics, medical tactics, access tactics, etc., to address the pain point for a specific stakeholder. Here in this case, we took the oncologist. We could also have taken, for example, payers. Now, what are the benefits and drawbacks of the Blockbuster adoption model versus the customer experience journey model? The Blockbuster adoption model helps define proven tactics, when they should be performed, and how much resources should be allocated to perform this. And through an intensive follow-up of the KPIs, you then ensure rapid uptake. And we all know that a rapid uptake of a new brand strongly correlates to a brand's long-term success. The drawback of this Blockbuster adoption model is that the tactics you define are driven by launch best practice analysis, rather than addressing a customer's specific feelings with respect to a specific innovation in a specific case. And for example, in the case of the adoption of next generation sequencing, which is massively parallel sequencing, the adoption of this particular approach in daily prescribing practice, there may not be any best practice as to how to get this particular prescriber to go through each of the steps of the journey. The journey might even be completely different to a classic adoption model. On the side of the customer experience journey modeling, you really get under the skin of a customer's activities, of a customer's thinking, allowing to identify pain points and then delivering innovative tactics to increase their satisfaction in key steps of the journey. Now, the challenge with the customer experience journey modeling is that we might be delivering all sorts of innovative tactics aimed at increasing customer satisfaction with a specific step in their journey, but we might not be directly driving a brand's success as a result of that. So, which model to adopt? Well, this is a typical case of the pendulum swinging. Some pharma companies who have a very strong focus on the brand adoption model, they might sometimes be actually lacking the identification of some very specific pain points in innovative situations, or misunderstanding them, ultimately reducing the performance. One pharma company I was working with, for example, created lots of difficulties for KOL collaboration by imposing all sorts of different communication channels with commercial, with medical, with compliance, which led KOLs to be a bit frustrated with working with this big pharma company. Now they have then adopted the customer experience journey modeling in a very strong way. Now, the drawback of that approach is it potentially reduces the focus on implementing tactics which are key to the success of a brand's adoption. So this is a clear situation where both of these models are very useful for the industry, but we need to find a good balance between using the tactics which focus on brand adoption and also learning from the customer experience journey modeling, helping to make sure that we understand what are the specific journeys of the various stakeholders, then benefiting from both.